Hello everybody, it's Eleanor from Birthzang here, just coming on very quickly today to talk a little bit about risk. This is a subject that I cover in my book, Helping Birth, which is a guide to pain relief and interventions. But to start off in the book, I talk a little bit about how we can process this information and how we can communicate with our birth team, for example. So I just wanted to cover today what risk means and the differences in the kinds of risk that we often need to assess. So really, when we're thinking of risks of pain relief options and choices or interventions, we are considering not really the benefits of that, because usually the benefit of whatever pain relief choice or intervention is going to be pretty clear. But actually we are talking about the side effects and any possible complications that might occur with that pain relief choice or intervention. And so when we look at the side effects and the possible complications, it's all very well reading a really long list of all the things that might go wrong. Not particularly helpful in itself, although it's always good to be really fully informed about those things, and that is what this book is all about. However, we also want to understand the likelihood of that thing happening. And so, for example, if you have gas and air, then for some people, you might find that it makes you feel really sick. Well, it's actually quite an unusual thing for that to happen. So understanding whether or not it's 80% likely or 20% likely is really going to help us in assessing how much that risk is going to have an impact on us. So how do we find out the likelihood? The only thing that we can do is to look at statistics at that pain relief choice or intervention and make an assessment based on those statistics. And statistics are a tricky thing because they can be manipulated, they can be presented in a particular way, they don't tell us the whole story. So it's only one aspect, if you like, of the story, but really it's the only one that we've got that has any kind of concrete basis. So there's lots of places that you can find statistics on pain relief choices and interventions. Birth Choice UK is a fantastic website. There's also statistics on the NICE website, the National Institute for Health and Clinical Excellence, which sets guidelines for health practice across the NHS and in England and the UK. If you Google it as well, if you write studies on side effects of gas and air statistics, for example, you'll often find there's a lot of places that you can find stuff. And my book is fully referenced, and there's lots of other places that you can find statistics. So feel free to drop me a line if there's anything in particular that you're looking for. So when we're looking at statistics, we have to remember two things. There's two ways of looking at risk. The first is relative risk, and this is when we are presented with maybe a percentage that changes depending on what's happening. So, for example, it may be, if you do this, you're 10% likely to have something happen, but if you do that, you're 20% likely to have something happen. Or in another way, what's often presented to us is that it's given to us as a doubling, for example, or a tripling. So if you do X, then the risk is low, but if you do Y, the risk is doubled or tripled. And often this language of doubling or tripling can give us a sense that something is really, really terrible. Sometimes the risk is, if we don't take an option, if you don't do this, the risk to your baby is double, for example. And that feels very terrifying to us. It feels very scary to hear, I'm twice as more likely to have X happen. When often it's not the whole story. And what we really, really need to be looking at is the absolute risk. And that's where we really start taking the statistics down to the nitty-gritty and looking at the actual figures, and then standing back from that and looking at the whole story. So the absolute risk is when you just take the number. For example, you might find a statistic that says, in this scenario, you are 0.5 out of 1,000 likely for this problem to happen. And if you take this course of action or don't take this course of action, you are 1.5 per 1,000 at risk of this happening. So that is, more than double the risk. It's triple the risk. But actually, when you look at the figures, the difference between 0.5 and 1.5 is very, 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 very tiny when you actually look at the wider population. So, thinking something is triple the risk or double the risk is not the same thing as looking at the actual statistics and understanding exactly what that risk means. So, statistics can sometimes be hard to wade through. And that's why in my book, I try very hard to kind of distill some of the key statistics, and everything is referenced, and give you the statistic and not the absolute risk and not the relative risk in the book. So you can make a decision based on the figures and not necessarily on emotive language, which may, make you feel that the risk is greater or less than perhaps it might be. So just a little tip to help you to understand how to assess risk. And this is true for anything in your life, not just labour and birth, so hopefully helpful. But that's it from me. I shall be back next week, and we'll be talking more about other subjects in the book. Hope to see you then. Have a wonderful day. Have a great weekend, and see you later. Bye.